Hi everyone, my name is Cindy Rivera, and in this presentation we will be discussing the diseases of the genital and urinary tract, more specifically trichomoniasis, chlamydia, and syphilis. I hope you all enjoy. I'm going to begin this presentation with the discussion of trichomoniasis, and the causative agent of trichomoniasis is Trichomonas vaginatus. Trichomonas vaginatus is a group of flagellated protozoa. They contain an anaerobic metabolism and lack mitochondria. This is the only known protozoan that infects the genital tract. Trichomoniasis is a common parasite of both males and females, and the incident is in part related to hygiene. Lastly, trichomoniasis is an STI, therefore it is transmitted through vaginal, oral, or anal sex with an infected individual. Trichomoniasis is an extracellular pathogen, meaning it will replicate in host tissues outside the host cell and rapidly spreads to establish an infection. The parasite adheres to epithelial cells to colonize the human host and interfaces with the host immune system and the vaginal microbiota. Inflammation is associated with this infection. The parasite attaches to the cells that line the surface of the vagina and produce a cytotoxin toxin that causes the host cells to round up and detach. This results in an immunological response and establishes a disruption of the normal flora. Next, we will discuss the patient's symptoms associated with trichomoniasis. Symptoms are not common, and trichomoniasis often goes unnoticed. But for those who do have symptoms, they include a yellow-green vaginal discharge, unpleasant odor associated with the discharge, usually painful or frequent urination and a burning sensation, painful intercourse, itching, swelling, and redness in or around the genital area. Men are usually asymptomatic, meaning they do not have any symptoms associated with the disease. A wet mount is the most common way to diagnose trichomoniasis. In this method, vaginal discharge is collected and used to make a wet mount. That wet mount is then used and examined under a microscope. As previously mentioned, trichomoniasis contains flagellum, which can often be observed in the wet mount. On this slide also is a picture depicting how a wet mount is done. There you have the physician swab some vaginal discharge, which is then used for examination. The diagnosis of trichomoniasis in men is often difficult to diagnose, most often because they do not display any symptoms. That being said, men are usually treated presumptively when trichomoniasis is diagnosed in their female sexual partners. This slide we will discuss the epidemiology of trichomoniasis. It is one of the most common STIs found in the United States. The CDC estimates that 5 million new cases occur annually. As we will see on the next slide, trichomoniasis occurs worldwide, and it is estimated that 120 million cases of trichomoniasis occur worldwide each year. On the next slide, we have a world map that estimates new cases of trichomoniasis among adults in 1999. The global total during this time was 173 million people infected with trichomoniasis. As you can tell from this slide, trichomoniasis is worldwide, infecting people all over the world. Lastly, to discuss on trichomoniasis is the treatment available for infected individuals. Antibiotic treatment is available for infected individuals. Metronidazole is most commonly prescribed, and this antibiotic works by eliminating the parasite by inhibiting nucleic acid synthesis. Now, with every STI, always avoid vaginal, oral, and anal sex until the treatment has completely eliminated the parasite. Treat all sexual partners and, of course, use protection. Next in this presentation, we will begin our discussion on chlamydia. Chlamydia's causative agent is Chlamydia trachomatis. This is an obligate intracellular gram-negative bacterium. Chlamydia is a sexually transmitted disease which infects the mucosal surfaces of humans. Also, chlamydia forms inclusion bodies inside infective cells. Overall, chlamydia generally infects the columnar epithelial cells or urethra in males and often becomes chronic, lasting months to more than a year if goes untreated. On this next slide, we will discuss the disease mechanism of chlamydia. The life cycle of chlamydia is approximately 48 to 72 hours. It requires that the bacteria live within a host cell and that they survive by replication. Those results in death of a cell. On the right side of the slide, we have an illustration that illustrates the life cycle of chlamydia. The elementary bodies seen here in blue in the image are a small infectious particle found in the secretions attached to and enter a cell to replicate. Within 8 hours, the elementary body transform into the reticulate body, seen here in like a reddish color. These reticulate bodies begin to multiply within an isolated area called an inclusion. Within 24 hours, some reticulate bodies reorganize back into elementary bodies, and as the cell wall bursts, the elementary bodies are released to infect adjacent cells or to be transmitted to infect another person. Chlamydia is often asymptomatic in patients. Around 75% of women and 50% of men are asymptomatic. However, for those who display symptoms, women will often experience burning during urination, pain during penetration, pain in the lower abdomen, or cervical bleeding or spotting, whereas men will experience penile discharge, burning sensation during urination, burning and itching around the opening of the urethra, or pain or swelling in the testicles. I also want to mention that chlamydia can also infect the rectum and even be the cause of an eye infection called conjunctivitis. Chlamydia can be diagnosed in one of two ways. The most common way is through a urine test. This is when a sample of your urine is collected and analyzed in the laboratory for the indication of the presence of this infection. A secondary form of diagnosis is through a swab. A swab is a collection of vaginal discharge in females and used to culture or antigen testing for chlamydia. For men, a swab testing may also be established where a doctor inserts a slim swab into the end of the penis to get a sample from the urethra. However, this isn't very common. Most men get a urine test. On this next slide, we will discuss the epidemiology of chlamydia. This figure of the United States map depicts rates of reported cases by state in the United States in 2016. The total rate of reported cases of chlamydia for the United States in outlying areas was 494 per 100,000 population. Chlamydia continues to be the most common reportable STD in the United States. However, infections are usually asymptomatic, and it is estimated that 2.9 million infections occur annually in the United States. Lastly, in our discussion of chlamydia, I want to discuss the treatment. However, I want to mention chlamydia can be associated with many infections and diseases that are undesirable. For example, long-term exposure to the pathogen can lead to infertility in both genders. Chlamydia can also subject women to pelvic inflammatory disease. When chlamydia goes untreated, women have an increased risk of cervical cancer and HIV transmission. So, again, on the slide, chlamydia can be associated with other sexually transmitted infections, pelvic inflammatory disease, and infertility. The good news is that chlamydia can be treated and cured with antibiotics. Commonly used are azithromycin, erythromycin, and doxycycline. Now, our last topic to discuss is syphilis. The causative agent of syphilis is Treponema pallidum. Syphilis only infects humans. There is no animal reservoir. They are motile spirochete and cannot grow in vitro, therefore it must be grown in tissue culture. On the right side of the slide, you'll be able to see the corkscrew spiral characteristic that is syphilis. On this next slide, we will discuss the disease mechanism of syphilis. Syphilis can be transmitted by sexual contact with infections, lesions. Also, syphilis can be transmitted to the fetus in utero. And lastly, syphilis can also be transmitted through blood transfusion. Spirochete can be found in the canker, usually the first site of manifestation of syphilis. All organs in the body can be invaded, but the skin, lymph nodes, and the central nervous system are the sites most often invaded. Lastly, the humoral and cell-mediated immune response are mounted against syphilis. Because of this, when syphilis goes untreated, it develops into 3 stages we will discuss on further slides. On this slide, we will discuss the patient's symptoms associated with syphilis. Syphilis can be characterized by 3 stages with varied symptoms within each stage. We will go more into detail within each stage on the next slide. However, in some cases, there can be no symptoms for several years. The contagious stages include the primary and secondary stages. Tertiary syphilis is not at all contagious, however, it has the most dangerous symptoms. So on this slide, we have the evolution stages of syphilis. If left untreated, syphilis can undergo 3 or even 4 stages within an infected individual. The primary stage involves painless ulcerations at the entry site of infection, meaning the penis, vagina, or oral mucosa. These sores are also called cankers. The secondary stage involves a skin rash, which starts on the trunk and spreads to the entire body, including the palms of the hands and soles of the feet. This stage may last several weeks and may relapse. In between the secondary phase and the final stage of syphilis, we have latent syphilis. During this time, the body will harbor the disease without symptoms, and the pathogen remains dormant in the body. Lastly, we have the tertiary stage. This stage causes severe damage to the central nervous system, cardiovascular system, muscles, bones, and other major organs of the body. As previously mentioned, this stage is the most dangerous. On this next slide, you see a picture of each individual stage of syphilis and their symptoms. As mentioned in stage 1, the patient undergoes these painless sores on their body, usually through the entry site of the infection. In stage 2, you see the body rash all over the patient's body, including the palm of their hands. And lastly, in stage 3, which usually occurs 15 years after initial infections, you see effects on the patient's internal organs. The diagnosis of syphilis is predominantly done by blood tests. A blood test can confirm the presence of antibodies that the body produces to fight infections. The antibody to the bacteria that caused syphilis remains in your body for years, so the test can be used to determine a current or past infection. In rare cases, a spinal tap can also be used to diagnose syphilis. This method is only used if it is suspected that you have a nervous system complication of syphilis and collect cerebral spinal fluid. In transition, we have the epidemiology of syphilis. The World Health Organization estimates 10.6 million new cases of syphilis in 2008. Syphilis occurs primary in persons between the ages of 15 and 40 years old. About 1 million infants are born each year with congenital syphilis. The incidence of primary and secondary syphilis in the United States fell dramatically with the introduction of penicillin in the 1940s. On this next slide, we have a chart of syphilis reported cases by stages of infection in the United States running from 1941 until 2011. In the United States, the incidence of syphilis has undergone major fluctuations. During the 1920s and the 1930s, syphilis rates were very high, but declined rapidly in the late 1940s with the introduction of penicillin. The numbers of reported cases rose between 1986 and 1990, but by the late 1990s, syphilis rates in the United States have declined. In the year 2000, the reported number of syphilis cases in the United States reached an all-time low, but since that time, cases of syphilis have steadily increased. For example, in 2011, a total of 30,644 cases of primary and secondary syphilis were reported in the United States. I'm going to end this presentation discussing the treatment of syphilis and the therapy strategies. On a positive note, syphilis can be treated successfully in the early stages. Early treatment with penicillin is important as long-term exposure to the disease can lead to life-threatening consequences as those seen in stage 3 syphilis. Nonetheless, therapy strategies will depend on the symptoms and when the person was exposed. For example, tertiary syphilis will require multiple injections of penicillin at weekly intervals. By doing so, curing the infection will prevent further damage to the body and safe sexual practices can resume. However, it cannot and will not undo any damages that has already occurred. For example, if the patient develops some sort of cardiovascular disease during stage 3 syphilis, these weekly injections of penicillin will cure the syphilis. However, the patient will continue to endure the cardiovascular disease that syphilis has caused them to endure. And this concludes my presentation on the diseases of the genital and urinary tract, discussing trichomoniasis, chlamydia, and syphilis. I hope you enjoy and thank you for watching.